Now let's study dampness. Dampness is prevalent in late summer. This period is when summer is changing into autumn, the time of a year with the most humidity. It has 4 properties and pathogenic characters. Dampness is a yin pathogen, apt to damage yang qi and hinder the qi dynamic. Dampness is characterized by heaviness and turbidity. Dampness is characterized by viscosity and stagnation. Dampness is characterized by downward going and being able to attack the yin portion of the body. Heaviness means that a disease has symptoms of a heavy sensation. For example, the head just feels like being bandaged tightly with aching and heavy feeling in the limbs. Turbidity means a disease present with filthy and foul discharges or secretions. The clinical manifestation are dirty complexion, hypersecretion in the eyes, and turbid urine. Dampness leads to sticky and greasy discharges and secretions. For example, sticky and greasy coating of the tongue. A disease caused by the dampness pathogen has a long course and relapses repeatedly. It lingers and is difficult to cure. Dampness is apt to damage the lower portion of the body. The clinical manifestations are edema mainly in the lower limbs, diarrhea and dysentery. Dryness. Dryness is prevalent in autumn. The climate in autumn is dry, and its atmosphere lacks in moisture. It has 2 properties and pathogenic characters. Dryness is a yang pathogen, characterized by aridness and puckeriness and apt to consume fluids. Dryness is prone to impaired lung. Dryness is apt to consume body fluid, giving rise to various dry symptoms and signs. For example, dry mouth and lips, thirst, dry nose and throat, scanty urine, and constipation. The lung is a dedicated organ. Dryness consumes the lung fluid so that the lung qi falls to diffuse and descend. It results in cough with a little sputum, and it's difficult to cough out sticky sputum. Fire. Fire and heat both belong to yang in nature and may be collectively called fire heat. It has 5 properties and pathogenic characters. Fire is a yang pathogen characterized by flaring up. Fire is like to consume qi and fluid. Fire is apt to stir up wind and cause bleeding. Fire tends to irritate and hurt spirit. Fire is likely to cause pyogenic infection. Fire pathogen invades the body often by going upward to disturb its upper part. It's marked by red tongue tip, oral or tongue ulcers, and toothache with swelling gums. Fire can burn the liver meridian, leading to an internal stirring of liver wind. It results in upward steering of eyes and raised neck. Fire may accelerate blood circulation, burn the vessels, and lead to bleeding. For example, tooth, nose, urine bleeding, hematuria, and hemophagia. The heart is of fire in the 5 elements, governing blood and hot spirit. Fire disturbs the heart spirit, leading to restlessness, fidget, delirium, mania, or coma. Fire invades the blood vessel by causing blood accumulation in local area and resulting in carbuncles and abscesses. It's marked by redness, swelling, hotness and pain, even pyogenesis, ulceration. These are 6 excesses: wind, cold, summer heat, dampness, dryness, and fire. The other ingenuous pathogenic factor is pestilential qi. Pestilential qi pathogens are kind of ingenuous pathogens with strong infectivity. They have the features of abrupt attack, serious conditions, similar symptoms, infectivity, and epimicity. This year's epidemic of new coronavirus belongs to the field of pestilential qi. We have finished the study of ingenuous pathogenic factors and will learn endogenous pathogenic factors. Thank you.